Hey everybody, it's Dr. Daniel Choi here at North Texas Dental Surgery, Wisdom Teeth and Denture Implant Center, and today I am joined by my lovely assistant Kaylon. We want to go over a pretty interesting topic, all on four, thinking about doing it. And Kaylon, did you know that basically, if we don't place your implants in the right spots, then you could have a tooth break off, or you can even lose an implant in the future?
Yes, because you've told me.
Okay, cool. Like we haven't seen it, but
Yeah.
obviously every day when we're doing these all on fours on patients, you're seeing me basically try to be meticulous about where I'm placing my
Yes,
implants,
very
right?
meticulous.
Okay, cool. So explain to me to the best of your knowledge why I'm doing that.
Why?
Yeah,
Like, why do you place them where you place them?
yeah. Like why I'm trying to spread them out first.
Yeah, so you spread them out so you can get almost like an even playing field. If you have four all in the front, then your back teeth aren't going to be as supported, versus if you spread them out evenly, you'll have enough support to where it can take the forces if you're like chewing.
Okay, basically, right. So it's kind of like imagine a highway overpass. You see those big beams, pillars of support. You don't see them all clustered in one area, or you don't see them super spread apart,
Yeah.
because the engineers basically have to imagine a situation where they have, like, let's say, all these semi trucks with full capacity driving over at the same time. They have to have basically max load, and what would we need for dimensions to be able to support that, right? So kind of similar concept. If we have an all on four, or depending on how many implants we place, 4, 5, 6, in this model we have 5 implants, we want to try to get them as equal distance from each other as possible, so that we can anticipate, because when we are chewing, our jaws produce an insane amount of force. These muscles here, the masseter and all these, what they call the muscles of mastication, they don't care whether you have all 32 teeth in your mouth, including wisdom teeth, or if you have 5 teeth in your mouth, or if you recently switched over to a all-on-4. Your jaws don't know that, and a lot of people, especially at night, clenching or grinding or whatever. Because of that, what we really need to do is make sure that we place enough implants to be able to handle that load and distribute that load as much as possible, right? And so, obviously the all-on-4 concept basically means that all-on-4 implants. That's how it was first invented, without going into too many details about that. But also another concept is, exactly like, okay, do we not only just getting enough implants to distribute that load, but also placing the implants where they need to be to distribute that load, right? So if I was to give a quick analogy, this dry erase board here, like, imagine that cost me $1 million, and I ask you to hang it up for me, right?
Yeah.
And like, if we imagine we didn't have any studs in the wall, and I said, okay, like, put as many screws up there as you feel that we need to make sure that the thing doesn't come crashing down, we lose our investment, then what you're probably going to do is you're probably going to want to distribute the screws, right? Not cluster them all in one area, right? Like, try to distribute them as much as possible.
Yeah.
God forbid somebody comes into it and try to knock it or whatever, then having that wide distribution should also help also in regards to like that case. So same thing like this too, right? So if someone's chewing, are they going to be chewing on the right side, should they chew on the left side, front? It shouldn't matter, right? Because our implants are widely distributed. So that's a very important concept that I wanted people to understand. Well, not only does that affect that, but also what can happen is, we talked about, if I have my last implant like right here, and I have a plastic prosthesis, a PMMA prosthesis, and then they chew over here, this tooth might break off, right? So imagine you spend all this money doing all on four and the tooth breaks off,
Yeah,
right?
not
You're
very
happy. Right. So, and then, with the materials nowadays, that really shouldn't happen, especially with zirconia or like the nanoceramics like Crystal Ultra. You might have seen that in some cases with the old hybrids with titanium bars and the acrylic baked on top of it. So that's really not too big of a concern. To me, one of the other bigger concerns, though, is if you have an implant over here, right, too forward up front, and then you're trying to hang too many teeth off the back end. That's what happens like when we create what we call a cantilevering effect, right? So it's almost like a seesaw effect, right? So if the implant's here, but then we're pushing way far over here, then what's going to happen is that you can create stresses that can either cause, again, those teeth to break off, but you also cause stresses on the implant, right? And so that can actually be a very a very common way to basically lose an implant, because what's going to happen is they're going to say you're overloading the implant. That implant shouldn't be receiving too many forces over there in that area that's causing that issue. So again, just to let you people know, this is why we need to place as many implants as we can with a wide distribution. Now let me ask a quick question. So again, the primary things, we don't want teeth breaking off, right? Because of excessive cantilevers, because the implant's too far away or the implants are spaced way too far away. You don't want them snapping if something's like biting into that area. And then another thing is we don't want to overload the implant. We don't want to stress the implant, because if you stress it too much, then that implant's just going to like basically lose its bond with the bone. And the same concept will kind of work with the wall, right? Like if I have pet screws like in the wall and like they're taking way too many force, then the screw can fail, right? So one other thing that I wanted to talk about. All right, I had to regain my train of thought there. So basically, what other like main issue are we going to talk about now? In an ideal world, I want to place those implants as equidistant from each other, but what dictates whether we can place them where we want?
Yeah. What may hinder it would be, I guess, like anatomy problems versus like how low your sinuses are. Your sinus may hinder where we place the implant.
Upper jaw, yep.
And then if it's your lower jaw, probably most likely your nerve that runs down.
Right. So your upper jaw has one of the biggest issues is going to be the sinus cavities. Some people have very large sinuses. So if I drill into a sinus cavity, then we got no support up there because it's all hanging out in air. If I'm putting a screw like into 1 inch of drywall and I put a 3-inch screw in there and I drill it all into the wall, it's hanging out in air or insulation, something back there for 2 inches. It's not getting any support from that, right? And it's very similar to basically with dental implants, right? So you don't want to drill in the sinus. So that's one aspect of anatomy that can affect us. Also, you mentioned the inferior alveolar nerve down here. We don't want to drill into that. So how much bone do we have? So certain factors come into play. So let's actually show you a case where that's happening. So this is one of our former patients. We did an all-on-4. Sinuses, actually, we look at these all the time. These sinus cavities are not a concern. They're far back enough. One thing I see here is that she lost these teeth here on her lower right side a long time ago. This is her right side. This is her left side. But can I place an implant right here, or I'm going to have to, place an implant diagonally to avoid that nerve? So let's take a look at her after. So basically on her case, we placed 5 implants up top because she did have softer bone. We placed 4 down here, and then we angled these implants to basically avoid these nerves. So, this is just an example of how, every case is different, right? People have infections in certain areas. People's nerves are laying in different areas, higher, lower. Basically how broken down are the teeth, where the sinuses. So many factors come into play that affect where I place my implants, which then therefore affect my what we call anterior posterior spread, how far the implants are from each other, how many teeth we can hang off the back, all these things. But we have to basically weigh all these things to make sure that we are not going to have teeth breaking off or dental implants that will be failing later on. So hopefully this information was helpful. If you guys have any questions, please feel free to leave a comment below. And also, if you could do us a favor, give us a thumbs up and a follow on our channel. We really appreciate it. Thank you so much.